Well, I'm just going to share my screen for a second while the people are signing on, because Dr. Fellows has allowed me a couple of minutes to just uh, introduce the survey that Dr. Hagelin and I have put together about the life cycle needs of the faculty. The invitation with the QR code is in the chat if you have a chance to have a look at that. And I'm just going to put this slide up here so you can see it as well. Hopefully we'll get some good insight into what the faculty and their various stages of your career are, what your needs are regarding support from the faculty and how you want us to communicate with you and develop a connection. You know, we're lucky to have Zoom and Teams to do a lot of the work we used to do in person in the past, but we also have lost something by doing that. That feeling of belonging and connection gets a little stretched. And we're hoping to re-engage some of you that have not felt connected to the faculty in the department. But we were going to open it up by asking what you think first. So I want to thank Dr. Fellows for allowing me this opportunity. And again, it's in the chat. I'll be sending an email with an invitation as well. So please give us your insights. Thank you.
Thank you. So I'm not sure what your formalities are at your grand rounds, whether I just jump in here, I'm happy to, but if there's some other formality or blessing, I don't want to interfere with that.
Well, I apologize. I usually there's somebody that introduces you formally, but welcome. We're happy to have you with us this morning and to talk about what the faculty is moving towards for better health. And I think everybody knows you, so I'll let you just go right ahead.
Perfect. Thanks, Shannon, and I actually appreciate the informality. I appreciate people taking the time to come this morning. I'm hoping that we'll be able to have a conversation rather than this isn't a lecture. But I've been over the last several months actually going around, often virtually like this, to various departments and schools to discuss and talk about strategic directions of the faculty. Over those months that I've been doing this, there's been a lot of changes at the university, in the province, and in the world. So the kind of nature of what could be discussed has been evolving. So I'd like, I'm happy to have enough flexibility in the session this morning to address questions or talk about how the general direction of the strategic plan is, I hope, going to help us navigate some of the challenges that seem to be, well, it's a volatile moment with changes, hourly, it seems, depending on how closely you're following the formerly known as Twitter feed of a certain U.S. president. But closer to home, I think there's lots going on in the hospitals, in the healthcare system, and academic mission requires us to keep our focus. It's a pleasure to talk to the Department of Surgery and friends because I really appreciate actually the engagement across this set of units in terms of the academic mission. You're say punching, generally speaking, above your weight in terms of commitment to teaching, research and innovation, and service at all levels, including many people who serve in leadership roles in the faculty. So in a moment, I'll put my slides up, and one of them says thank you in big letters, but let me say it now. Thank you very much for the work you're doing for the academic mission and for your presence this morning, which speaks exactly to that, to the importance that I know you all hold the academic mission in. Before I start putting up slides and lose contact with who's here, I like to start by kind of centering us a bit on the academic mission and why we engage with it, or why you engage with it. And I guess I'd propose, if you have access to your chat, or if you want to just raise your hand and speak up, to to think for a minute about what it is that you gain from, or why you engage with the academic mission, whatever your particular role might be. You're all teachers. Some of you are also very engaged in research and, as I mentioned, service. When you think about that work, I'd like one verb that comes to mind in terms of what you think about in your academic role. What verb captures the actions that you may take or that you especially value in your academic role? See how awake folks are. Oh, surgeons get up early. Feel free okay, to learn. That is definitely a good reason to teach, is to learn. Other verbs that reflect your academic engagement: to grow, motivate, connect, nurture. Finding out who's got two hands on the wheel as they're driving to work. Inspire. It's certainly true that especially a teaching role, but in general, that academic work magnifies your impact. It's not one patient at a time. It might be one student at the time, but the difference you're making with that student ripples out for years to come, potentially. And if you one of the reasons that we encourage people to go beyond their own, optimization of their own practice or innovation in their own work to the academic excellence of taking those ideas to the peer-reviewed test publishing, is that the impact is then magnified, or you change practice in many places, not just in your own activity. And that's why academic medicine is so important, because it magnifies what we do individually. All right, I am going to put up slides and explain to you what I was hoping to do. Well, let's see if I'll try to put up slides. Yes, I can access them. That's good. Hopefully you can see that. It's not February 19th. I think it's later than that, but thereabouts. I don't have anything to disclose. My interest here is to advance the university's mission. There are learning objectives in case these are needed for your CME. I'd kind of give you a bit of a summary, I guess, of the context as we see it from the faculty point of view, capital F. Talk about the strategic priorities that have emerged from a strategic planning enterprise over the last year, and get your thoughts and reflections on those and how you see us best putting them into action. I want to mention again the Our Words Matter campaign that's been running for a while to kind of keep us, remind us about the existence of that and the tools that come with that. And as I said at the beginning, let me say it again, merci. Thank you for the work that you're doing in the academic mission. I don't take it for granted. It's extremely valuable, and I hope it's valuable to you. I think some of the words that were typed into the chat suggest that it does bring value to the work that you do, and it certainly makes a difference to our students and our patients. Why are we here? So that was my icebreaker. So the current context, I mean, there's lots of ways we can think about the current context, but it's important to kind of emphasize some of the points that are especially pertinent and that are relevant to thinking about what we're doing in this moment. First is, in the last year and a half, there's been a lot of change to the university's financial status. Sometimes that's the institution's own fault, but in this case, it was largely due to external changes brought by the Quebec government and then the federal government to a whole variety of programs that have an direct impact on how universities are funded and how McGill University in particular is funded. I don't necessarily need to go into every detail except to say that the amount of money that that tuition brings to the university and that government kind of grants that relate to the number of students we teach changed, not in our favor. And then a number of additional steps were taken after that made the news of, over a year ago that have also had a negative impact. One is the across the country, the kind of shift in thinking about international students and the pressures to reduce those numbers across the country, and then specifically in Quebec, which has those students are an important source of revenue. They pay a high tuition, and the universities had been motivated and oriented to bringing more of them in, aligning with our mission to train the world, but also for economic reasons. And the abrupt change in policy around that has had an impact on immediate impact on finances and on planning around finances. And then the other thing that's happened is the provincial government is short on cash and has put limits on capital spending across the whole public sector, which affects universities and indeed hospitals and schools. So that's had an impact as well. I don't need to tell you that the health system is in reorganization again, and that's, of course, adding complexity. One of the concerns we have about that on the academic side is that Santé Quebec, to date, has appropriately, I suppose, been focused really on the delivery of healthcare, and it's been a little less clear how the academic mission within the healthcare system will be thought about by Santé Quebec, let's say. What is clear about that, though, is that we've always had really close relations with, of course, with our affiliated healthcare partners in terms of teaching hospitals, clinical settings where teaching is conducted. That relationship is only more important, so particularly tightly linked these days because as the healthcare system's changing, we need to make sure the academic mission remains, valued and feasible in this context. I think it's vitally important. We can reorganize the healthcare system to deliver healthcare today better. I'm sure we can do better. But if we don't include teaching and research and innovation in our thinking around that, then we're not thinking at all about healthcare tomorrow, and that's not good. To some degree, the government has been concerned about healthcare tomorrow, and as you know, there's been a shortage of human resources and across all professions that have had huge impacts. I don't need to tell you on the delivery of healthcare services. Somebody's unmuted who might want to mute. One of the impacts is that the government has asked all 4 medical schools in Quebec to fairly rapidly increase the number of medical students we train. And we have said yes and tried to respond to the numbers they've asked us to take. At McGill, this means that this year's class is the largest in history, 251 students across 2 campuses. And that number, we've stepped up rapidly to that number. At the moment, that's the top number we've committed to. But of course, as we work through the 4 years of that number, that's 1,000 McGill medical students in our system in the next 2 or 3 years who will be in the clinical system soon. Likewise, there's been an effort to increase nursing. One of the differences between nursing and medicine in this regard is there's a need for nurses. There's less enthusiasm by students for applying to nursing, but our nursing programs have been innovating, providing ways to upskill and engage nursing training in a variety of ways, including an online training, and as well adding many nurse practitioner programs. So there's a lot of activity in the School of Nursing. In the last sort of general point, and I'm happy to take questions and talk about this more perhaps at the end, but is that in response to these fiscal changes for the university, we've had no choice but to quite quickly really be working on ways to reduce our spending in order to bring our cost in line with our abruptly reduced revenues. And just to give a sense of magnitude, that's globally speaking across several years, we're expecting that in a recurrent way, we need to be about 10% cheaper in the sense of the costs without losing our student numbers, without threatening the quality of what we do. And that's in this year, the current budget planning, which is going on right now for fiscal year 26, that's 4.5 to 5% cost-cutting exercise this year. This year is a particularly challenging one. We have to really make a reduction because we want to avoid having a deficit 2 years in a row. We had one last year despite cost compressions, partly because the changes came through the fiscal year. It was hard to rapidly adjust. As a public institution, we're not allowed to run deficits, and 2 years in a row threatens the possibility of the government coming to oversee our finances under a tutelle type of arrangement, and nobody wants that. We want to retain the liberty to make our own choices about how to use the resources we have, not to be under some oversight regime. So this year, that's a big focus. Although this is tough, I really think it's an opportunity to, I don't want you to type into the chat all the things you find aggravating and inefficient about your interface with McGill. Please do not do that. But I'm sure that if I asked you to, you would have a list of things. This is an opportunity for us to think about how we're doing things to modernize our administrative services, to refocus our academic programs, to make ourselves, a tight ship, I guess is how I think of it, so that we can really accomplish what we need to accomplish effectively, even in resource scarce times, which seem likely to continue just based on the overall public circumstances. I have a lot of confidence that we're going to be able to do this, that we are already doing this. This faculty is very strong. We have amazing people, you amongst them, really strong education programs, highly committed teaching faculty, outstanding world-leading research, broad and deep expertise. One of the things I think that we're particularly strong at, that's sometimes a bit of an intangible, is the ability to work together across disciplines, across professions, whether that's in the healthcare setting or in our teaching, in our research. To really do that effectively and meaningfully, I think is a special thing that McGill is particularly good at, maybe because we're so often slightly under siege. We work well together. And that collaborative spirit, I think, is particularly needed now. It's also particularly pertinent to the present and the future. I think are interprofessional, they're interdisciplinary, and we know how to do that. We are doing that, and that's, I think, an advantage. It also is a way to bring the academic work, the innovation and research to action, which I think is also of the moment. It's not a time for ivory tower pontification. It's a time to take the research that we do, the evidence-based understandings that we can develop, and make sure they're having an impact in healthcare and public health. We have excellent hospitals, research institutes that are, again, world-class. And we've been able to expand physically in our new campus Outaouais for the medical school in a way that I think is very helpful to keep growing and anchoring ourselves really well in Quebec in terms of not just Montreal, but the whole province, our commitment to the whole region that we serve, and having a physical presence. Also, comme vous savez probablement, en Outaouais, nous enseignons entièrement en français. Le programme au complet est offert en français. That's actually quite a big impressive accomplishment for McGill to be running two MDCM programs, one in French and one in English in parallel on two campuses. It's a real commitment to our social responsibility. And it opened in 2020, and it's really starting to gain momentum there in Outaouais. So I think it's a great example of us being innovative and responding to our community's needs in a very concrete, direct way. So I started as dean about a year and a half ago, I guess. And in the context of a new administration, we began the work of just refreshing and thinking about where we wanted to go as a faculty, a strategic plan. I didn't want to get super bogged down in some elaborate, long strategic plan, but I did think it was important for us to be having conversations across the faculty, kind of reminding ourselves about what the current priorities, the most important things to focus on are, and to discuss that together. And this session today is part of that conversation, and I'll stop talking in a minute and get your input. So it is actually a conversation, but if you haven't been following the development of the strategic plan, it has gone on for about a year, and the The Dean's Operations Committee has been overseeing it. There have been a whole series of consultations of different kinds. About just after Christmas, we settled on a final version that I'm going to show you. As you'll see, it's quite a high-level plan. I wanted it to fit on 2 pages, which it does. The idea is that that's going to set the sort of general orientation for the faculty and for the School of Medicine for the foreseeable future. And then we're going to take those general strategic orientations and turn them into much more specific, concrete actions that we can move forward 1 year at a time in a more focused, specific way. If you want more information about the plan's development or about it, it's all online. This is it. The first page. We've chosen the tagline "Together for Better Health" to capture our vision. All of those words, I think, are very important. And I think the fact that Shannon began by talking about a mentorship program in your department speaks to the importance of continuing to focus on the together part. And of course, better health is what we're here for. And reminding ourselves of the need to take what we do and turn it into action, I think, is captured by that, I hope. The mission statement that you see on the left there is it's been the mission of the faculty for a long time. We changed it slightly. We've kept the focus on science and humanism together, which is it's our brand, it's our thing. It's what we do really well in terms of our clinical training and in terms of how we think about biomedical and health clinical research, I think. And we've added more explicitly the focus on the health of the people of Quebec, as well as communities around the world, to keep ourselves focused on that. There are 5 values that we chose. They're on the bottom here in red, that are meant to inform all we do. And then there's 4 major strategic orientations that you see here in our little pyramid, with learners at the center, outstanding education at the center, to keep the teaching and learning mandate of the faculty really literally centered. The 3 other equally important themes have to do with using research and innovation in a collaborative way. The faculty's job, I think, is to bring together those strengths to have a positive impact on health, whether that's healthcare or population health, that we really think about how to bring together activities in the faculty and beyond to have an impact on positive impact on health. We've explicitly talked about working with and for our communities and how we do this to really help us remind ourselves of how we need to engage with the people we serve. And then the last thing, which was in the plan from the beginning, but has become increasingly important over the last year, is to really think about how we are delivering on our mission in terms of efficiency and effectiveness, to make sure we're doing that as well as we can. So that's page 1, and this is page 2, which is just going into some more detail on the 4 big themes. Just a little bit more detail. We've tried to be specific, and I'm going to go through these one at a time and kind of get your thoughts on each, so you don't necessarily have to read this whole slide. But that's basically the strategic plan on 2 pages. And as I mentioned, the next steps are to turn this into action. I don't want to go over this exhaustively, but we picked the values with intention and put old-fashioned values of altruism and humanism, which I think, and I think most people believe, are really central to healthcare education, and research that has impacts on health. We chose to go back to those sort of older terms that I think bring with them ideas of service to the community, and the value of each individual, the dignity of each person, no matter their background. The ideas around equity and inclusion, I think, are incorporated into ideas of humanism, at least that's how I see it. I hope these resonate with you. So I'm going to just go through each of the 4 themes briefly. As I mentioned, we put learning and our learners at the center. The word outstanding, I think, speaks to our ambition. It's not meant to be thought of in a very rigid, narrow way as somehow academic excellence of an old-fashioned kind, but rather outstanding in a more holistic way, thinking about the many ways that people can be outstanding, that we attract such students, and that we, in our educational mission, prepare them to stand out as leaders and collaborators and have the ability to work across disciplines, as well as developing the disciplinary depth that is kind of the hallmark, I think, of what we're doing. And the third point is that we're including our faculty and staff as our learners as well, that is ourselves as lifelong learners, to think about how we can continue to sustain and augment our own skills, our staff's capacity to continue to be excellent in a world that's changing all the time. Maybe I'll invite people, if they wish, to raise their hands and comment. I'm going to go through the 4 themes briefly, but if you wanted to touch on each of them as we go, people have thoughts about this. As I mentioned, this is high level. This is going to guide us for the next few years, at least. And the next step is to go to action. And those actions are either going to be considered as actions that need to be taken at the faculty level that cut across all that we do, or actions that are relevant in the School of Medicine, which you are part of. And I'll just give you some examples and maybe invite conversation and reflection on this. One of the things that's clear to us looking across the faculty is that amongst the portfolio of things we're doing, graduate training, thesis-based graduate training, that there's room in general across the faculty to do better there, that small or larger changes could really help us be more certain that we're really attracting the best students, getting them efficiently recruited, enrolled, on track through their degrees, and providing them with cross-cutting types of curriculum that do more than just give them their disciplinary depth. That there's room to innovate here that we haven't taken, and McGill attracts great students just by its because it has great faculty, because it has a great name. But I don't think we should be resting on our laurels. I think we should be working harder to make sure we're attracting the best students. I know your graduate program in the Department of Surgery hosts and is, I think, in line with this thinking. We're going to be looking right across the faculty at how we can assess how we're doing, help the program directors and people involved in the graduate training understand the variables they should be thinking about, and make improvements, especially ones that could be considered sort of cross-cutting improvements. It goes without saying, but let me say it, that a priority definitely needs for the School of Medicine needs to be to make sure that our accredited programs are successfully accredited, that we are keeping in mind as we make changes to our administration, to our services, to our organization, that we are keeping the accreditation standards in mind and making sure that we're effectively meeting those in a way that's as sort of efficient as possible. We get caught out by accreditation if we treat it as a once in a while thing rather than building in the quality assurance that we need and making sure our processes also meet accreditation standards as we go. And then the last on this one, we may touch on other things, but these are some of the actions we're planning to take at the faculty level. Is transforming I call the education offices. The faculty has a number of offices that fall broadly under the education portfolio. Faculty development, for example, social accountability, and Office of Interprofessional Education, that we're really taking a hard look at whether those offices are serving their current purposes, whether the environment has changed in a way that needs us to change how we deliver on these key priorities. So we're looking at that now. Invite people to comment on these or thoughts you have about other actions in this area. People feel energetic this morning. Don't be shy, but you need to put your hand up so I can see you, or speak up. Should I try to promote some competitive spirit? When I presented to obstetrics and gynecology, they spoke up. Do these examples of actions seem to you relevant? Feel free to tell me no. Now's the time. We haven't done them yet. Or are there other things you see that seem more pertinent? I see there's some trainees joined in, feel free to raise your hand and tell me that this isn't meeting your needs or that it definitely is.
Hi, Lesley, Nader here. I'd like to comment and ask a question.
Yep.
Yeah, as you know, I'm being, a heavily hospital-based, environment, for, both research and teaching. We are very much affected by our healthcare system, and I guess surgeons in this audience knows very well that, we have excellent training in all our programs, but we can be threatened, and part of the threat can be from the lack of, basically resources necessary to do our job. And we teach surgery, and that means we have to be in the operating room and bring these trainees with us. And when the restrictions are so much and we are difficult to to actually provide that kind of care, we can't train either. We can't serve our patients. We can't train either. The question I have is that is it possible that we can kind of think how the faculty can help Department of Surgery in general, surgical mission, to be able to really build these resources, going to the future. We don't work in vacuum, right? We have a lot of, professionals that help us in our training, ground, that we can actually be prepared for the future, that, we don't lack, the personnel. For example, like, maybe the faculty can think about, new programs such as PAs, operating room technologists, programs offered to attract individuals that can help us to run our work at the hospital. At the same time, brings more students to the university and help the budgetary issues, right? So you should think about new programs. Obviously, bolster our existing programs such as nursing, but also think about new programs that can help those of us that work in the hospital environment, in particular in surgery, to be able to carry on our functions, and that those functions that we serve the public is actually extremely important for our training as well. We don't serve public, we can't train our students and and the residents and fellows. And I think that's right now, the surgical mission is in a huge suffering from these manpower and the HR issues.
Yeah. I think those are really interesting ideas. I guess I will say first, the faculty is very aware of the fact that the functioning of the healthcare system, the work of clinicians who are, in their clinical role, is totally tightly tied to the teaching role. And we advocate at every table we're at about the importance of remembering the academic mission, of knowing it's the same people who are the healthcare. We're delivering healthcare and delivering education and carrying out research and innovation. And so we've been advocating about that with Santé Quebec. If to the extent that they're thinking about indicators and so on, we've been working to try to make sure that academic indicators are amongst the things that are being considered. We know, of course, it's usually a little slower when you're also teaching as well as carrying out the clinical care. So we've been working on that part. And at the faculty level, I'm a clinician myself. I understand how important it is that we try really hard not to add work into the mix, so that we try to streamline our processes. We try to make it as easy as possible for you to do the work that we need you to do, which is our teaching mission, and not get you bogged down in administrative steps as best we can. The degree to which factors like accreditation and so on are tying our hands a bit is tough, but we're advocating and looking within the scope of what we can control to make sure that the administrative support and the processes involved are as painless as possible, so that at least the people who are currently in the system, that the work they're doing is as pertinent as possible to their expertise. That's the orientation we have. Whether we're delivering on that, that's another matter. But we're very actively thinking about that and working on that. And as some of you may know, we've undertaken a major reorganization that's going to be rolling out in the next few months of how clinical programs, residency, and fellowship programs are supported administratively. So that's just one thing I wanted to mention, reorganizing to try to be more effective with the resources we have to help you be more effective in how you're spending your time. The point you're making about thinking about outside the box a bit, about training other kinds of healthcare professionals, training current healthcare professional students in working in different ways with each other in terms of interprofessionalism. How do we integrate nurse practitioners, other kinds of advanced skills, allied health personnel. So these are things to think about. The particular ones you're raising about physician, there's a whole bunch of categories now in terms of physician assistants and associates and clinical associates and other kinds of categories that are being looked at the regulatory level. The collège, for example, is looking at how will this work? What are the other categories? How can we expand our workforce without waiting the 10 years it takes to train someone from scratch to be a physician, for example? So we're part of those conversations. I think it is definitely, I agree, we should be thinking about whether the training is something we should offer, and if so, how. So I welcome your, engagement around those things and the more specific disciplines. Developing programs and getting them up and running takes time, is a bureaucratic exercise in our province, and doesn't tend to rapidly yield new resources. But if it's going to change the healthcare, that we offer over 5 or 10 years, then we should definitely be engaging with it. So, yes, thank you for bringing that up. Maybe, unless there's other comments on this slide, I'm just going to advance, but I am going to ask for your input. Thanks, Nader, for making this a conversation. The second theme, in no particular order, is related to research, collaborative research and care for better health. And here I'm speaking still rather generally about the kinds of things the faculty can do. That I think a research culture is more important than ever. Under constrained circumstances, there's a tendency to feel like this is no time for innovation. We should just do what we know how to do. I think, on the contrary, we should challenge ourselves to do things differently. We already know that even with all the efforts we're doing to train as many medical students as we can as fast as possible, that we're going to be short of staff and for the foreseeable future. And that, as Nader's comments were reflecting, suggests we need to find different ways of doing things. And we're smart and innovative people. Let's do it. That's our job. So to help do that, the faculty is there to help you in your thinking on that, and to bring resources where we can, to raise resources where we can, to do this in an impactful way. At the faculty level, the high level, to me, the main role we have to do is bringing together people, helping to make sure resources are available that are cross-cutting, that help to connect nodes of strength within departments or research centers. And then the last, which I mentioned at the beginning, is that I really think research is positioned now to really, I don't think I need to tell you, it is having impacts on clinical care at a much faster rate than, I don't know, when I started my career, where we did research and thought someday it would change things. Now research is changing things. And at McGill, we're really well positioned with our strongly integrated hospital and research missions to have that translational impact. And I think we should keep working on that. There's some examples of what we might do at the School of Medicine or the Faculty of Medicine level. Strengthen the clinician scientist training continuum and professional continuum. As I mentioned, orient our fundraising so it can be maximally impactful in this sort of space. And think about hiring faculty who are on purpose to connect across the so-called valleys of death that they talk about between basic research and the clinic, to think about hiring people with the expertise to do the research and putting them in pairs or teams to carry that out. And I think there's lots of good examples already in the faculty, including in your departments. Are there thoughts about this one? People want to comment on the sort of collaborative research space and what we might be doing here to make this work as well as we can? From someone besides Nader? Very quiet group. Either that or you're all stuck on the Decari. If so, keep your eyes on the road. All right. Well, I'll carry on. If you have thoughts, you can always email me. The community engagement piece, I think is a important and a bit challenging. It's a little less straightforward for us to think about how to best do this at this time. It's in a way endless. There are endless possibilities. What are the priorities that are going to have a real impact? So one, I think there's no doubt we're fostering a culture of openness and inclusion that That is very important. It's important to our learning environment, our work environment, our own experiences in those environments, and it's at the core of the faculty's mission. So that we will not take our eyes off that. Engaging with communities that we serve, especially communities that we haven't served so well historically, Indigenous communities, for example, but others, to really understand their needs and be partners with them in their care, and how we educate our trainees and ourselves. And then I think doing a better job of our role in Quebec. We're very much present in Quebec. I needed to tell a clinical audience that, but it's not always clear. I don't think we're tooting our own horn enough. I don't think we're maybe that tooting our horn part is not so much the point, not telling Quebec that we're here, but engaging with the Quebec society in all contexts and communities to be part of those communities. And Outaouais is a good example where it takes a while for people to understand that McGill is there. McGill's been there for years. That McGill's there in French. It goes against the stereotypes of what is McGill. And I think we need to make clear that the modern university academic mission, especially in the health setting, is not the 1820s, that we're very much there and doing all kinds of great work in all kinds of contexts, from underserved regions off island to the far north. Some examples of what we think we will be doing is to continue to expand and augment the successful efforts we've been making to bring talented students in from these historically underrepresented groups and help them be successful parts of our faculty across all the healthcare professions and research. Doing a better job of reporting on how we're doing with equity and diversity, so that we can together be more as intentional as possible about ensuring we're reflecting the communities we serve and our faculty, staff, and students, and engaging with Quebec en français in a variety of ways. So those are some thoughts. If people have other ideas, I'm happy to hear them. Understanding the early hour, I will give you the last section here, which has to do with the efficiency of how we're supporting the academic mission in all senses. We've really chunked this into three areas: attracting the very best people into our administrative teams and developing and retaining them. We have great people. We need more of those great people, and we value their work. They need to hear that, understand that, and we need to help them upskill, be engaged, develop, so that they see their whole careers at McGill in a way that's very positive. I think there's lots of work we can do here on improving the tools we use, the consistency of how this is done. I mean, this is nuts and bolts stuff, but it really has an impact. I know it has an impact on you in your everyday work as you're struggling with complicated IT systems that don't work well in the hospitals or whatever, that we need to focus on this, because even if we can make small improvements here, it has wide impacts on your own productivity and state of mind. So this is something that's on my mind. It's not necessarily been a traditional focus of a strategic plan in the faculty. I think it's important that we do a good job of this. And there's plenty of room to do better. This meshes well with the university because they have also determined that now's a good time to get systems working better, and are going to be bringing in a number of initiatives to help us do that. So it's really a good timing. Here's some examples of being more evidence-driven, indicators of how we're actually doing, making sure that the resources we have are being applied equitably across different programs of similar size and need, and so on. These are just some examples. So, as I mentioned, the next step is to go to an action plan where we'll be finalizing that in the next couple of weeks. We'll be sharing that. It'll be online. We'll be showing you how we're making progress on it. We'll be engaging with you on some of the actions which require input, working groups, thought. And for more concrete, practical things, we're just going to jump in and get some of these things we're already doing, of course, but we'll hold ourselves to account on these things, and in a transparent way. The last point I wanted to make before we open it to questions or any other discussion points is that to remind you of the Our Words Matter campaign that was started a few years ago under the former dean, David Eilman, as a way to help us all keep in mind the importance of how we act, behave, speak, interact to our mutual work and learning environments, that small steps of thoughtfulness about how we express ourselves, how we make people feel included, that it's important to keep this in mind. It makes a huge difference to the quality of our working and learning lives. And under pressure, and it can be easy to let this slip. So the idea of remembering that our words matter, that making a commitment to each other to be welcoming, be inclusive, be thoughtful about how we have sometimes difficult conversations in a collegial way, to sustain a culture where we care about each other and show it. I wanted to mention a couple of tools that the faculty's developed to help you with this. There's two video modules that are around themes that people have told us they found particularly tricky, or spots where it seems sometimes conflicts could easily arise, or people could easily misunderstand or miscommunicate. One is a module on microaggressions that was developed a couple of years ago. This is a video module. You can get it through my courses. I'll share the link in a moment. You may well have already seen it. We put a big push to try to have as many people watch it as possible. It's very good. It's very brief. It just helps remind us of how small changes in how we interact with people can make a really big difference in how they feel included. I encourage you to watch it again if you haven't looked at it recently. It bears rewatching, and to think about it in your day-to-day work. The other is a newer module that's on giving constructive feedback. It's intended for everybody. It's not specific to faculty. It's relevant to trainees, to administrative staff. We heard from you that moment of giving feedback, whether it's colleague to colleague, colleague to student, between students at different training levels, is often a moment of tension, or where things can go wrong, or where people feel uncomfortable. This module is a 20 minutes or so video, very straightforward, basic principles that I believe is quite helpful. I encourage you to think about accessing and watching it together at a staff meeting or a team meeting, and discussing how the principles can be applied in your context. It's an example of the kinds of tools that I think the faculty will be rolling out more, easily accessible, available in French and English, and to help us all kind of together build a set of skills that's going to make for a positive workplace and learning environment. The next slide just shows you the access point. I'll share these slides with you afterwards. And I'm going to stop there with another thank you and close my slide so I can see you again. Hello. So I have a few minutes left here. I'm happy to answer questions about anything that's going on at the university or in relation to the strategic plan, or get your input on any of this, whether you're excited about it or not. Especially if you're not, tell me now. Hello, go ahead.
Hi, good morning, Dr. Fellows. Thanks for your presentation, and I really appreciate also your optimism despite the changes and the uncertainty coming with Santé Quebec and everything. So I'm Melanie Obey. I'm the current PD for urology, and I had a question mainly regarding like the increase in numbers. For example, you mentioned how we're accepting more and more medical students, and are we going to see a reflection in that in increased residency spots? Because, for example, in urology, we lost one of our CARMS positions a couple of years ago. It was given to Université de Montréal. We've advocated with Dean Edelman previously, and unfortunately, his hands were tied. It was really in the hands of the ministry to increase the number of residency positions at McGill, and I'm wondering if that's something we can see in the foreseeable future.
Yeah, thanks for that question. So I guess there's a few parts to that. So Yes, we anticipate that the number of CARM spots will go up in the province to match more or less the number of trainees coming out every year. Ordinarily, that's the intention. We don't want to train medical students up to a point and then not have residency spots for them. So we can anticipate that the number of residents will go up, so that our medical students have opportunities in postgraduate training. That's one point. What specialties, what areas, that's the second point. And then at what universities, that's the third point. So the general intention and the general agreement for a long time now is that the proportion of residency spots broadly overall is proportional to the number of medical students in each school. So all the schools have increased their numbers in lockstep. We have shared the increases in proportion to the way we already shared the number of students across the province. And McGill, I guess for political reasons, maybe I shouldn't say that out loud, I presume, has historically had relatively small number of medical students compared to our teaching capacity and the size and intensity of our training context. That we're similar size to Sherbrooke in terms of the number of medical students. And that as a result, our proportion of residents is relatively smaller than our capacity. I know, and certainly in base specialties, I've been told repeatedly, I believe that we have far more capacity to train than we currently are asked to train in specialties. Of course, where the government is focused is family medicine, where we also have excellent training. Largely for political reasons, the current focus of the government is on a proportion of 55% family doctors, 45% all other specialties. That's what the government's kind of broad orientation is, the political direction that is being set for the Ministry of Health. I mean, it's true that we are very short on primary care. There's no doubt about it. It's also true that we're short on all types of physicians, and if we're not short on them now, we'll be short on them in 5 years or whatever. We can just look around and see that, and the demographics are moving in those directions. All the modeling suggests that we are, we definitely need more family doctors, but we also just need more doctors. That's a conversation to have, of course, with your specialty organizations as well, who are at the table and thinking about the number of slots that are going to be made available across the province in every single specialty. So the government sets the numbers. It's partly based on this traditional historical agreement about how these things would be divided across the 4 medical schools. And it's not necessarily related to the size or intensity of your service, which I know leads to challenges of running a service. And also sometimes people just feel it's a shame we're missing the opportunity to train when you have capacity. Of course, our response to that over the years has been to bring in visa-sponsored trainees to fill in the extra spots, to provide our top training to people who need and can afford to pay our tuition to gather it. We continue with that. I think we should keep doing that really well. How this is exactly going to play out over the next 5 years, I'm not sure, but I guess my orientation to that first is that, I and my team are at the table for these discussions. I encourage you to be involved in your specialty organizations and to push on the other side for that in your own area. I think McGill has the capacity to offer amazing training in pretty much every Royal College specialty, including family medicine as well. We should be doing all that. And as needs are increasing, or if they're increasing in specific ways, as for example, a new hospital is opened and suddenly we need all kinds of new physicians, well, I'm raising my hand and saying McGill could train those people. Whether we'll have the opportunity to, probably depends a lot on, I don't know, who wins the next election. Unfortunately, the decision-making on some of this stuff ends up departing a bit from evidence and models and moving into political space. The more we can communicate in the public sphere about this in a orderly, evidence-based way, the better. So that strategy of being more present in our Quebec role, in our service to Quebec population, includes being more present in our specialty organizations, in our physicians have a lot of political leverage. We should be there at the table in those conversations. I gave you guys a pretty wide ranging response, but that's kind of where we're at. That's why That's why things are like that. Some of this is really in our control, and we should work on that. And other parts are broader societal and political conversations that we can try to influence.
Thank you.
Patrick?
So, hi, Lesley. For those, we were classmates, right? So that hence the familiarity. You've given a lot of very good answers about concerns I have. Our great capacity to train, our known predicted shortage in surgeons in Quebec. In general surgery, we already have a shortage. We can't fill our positions. Even our positions at McGill are some of them remained unmanned. We expect a shortage of 65 surgeons in Quebec within 3 years, 95 in 12 years, at the current rate of training of 15 residents per year. We used to train 18. We were cut in 2018. We've been lobbying to get the numbers back up, and that has been denied up to now. We need the faculty to be aligned with us in lobbying in favor of increased training in surgical specialties, and you seem to understand that the need. This is with the current needs, but the needs are growing. The population has grown several percentage in the last 5 years. The population is getting older, or our surgical specialties are getting more complex. It takes more people to do the same work as it used to. And so we're not preparing ourselves as a society for that increased needs. Yet we have great capacity to train. We take 8 trainees per year in our program, but only 3 of them come from the CARMS match. And so I think we have a responsibility to at least lobby strongly in favor of training our people to get surgeons that will be able to care for us in the future. My concern is accepting some of the historical ways of doing things. The distribution of residency spots from the different universities being proportional to the medical school class should be challenged. It shouldn't be maybe the overall number of residency positions, but the distribution among specialties should really be by capacity to train. And we certainly in surgery, in general surgery, but I suspect in many of the subspecialties also have extra capacity to train and can play a very vital role in doing so. Thanks, Les.
Yeah, so I absolutely understand what you're saying, and it's a question of navigating a tricky landscape because the political direction that's been set very clearly in response to public concern is around family medicine. And, we need to respond to that. We are responding to that. We have strong family medicine training. Our training programs usually fill across all sites. It's rare that we have open spots in our family medicine program, but again, we're training relatively fewer compared to the other medical schools. Sherbrooke and us are about the same, and the other 2 are larger. Even in family medicine, we've also made the case that, to the extent that people during CARMS leave the province, it's often because they want to pursue specialty training outside of family medicine, and the slots aren't available in Quebec. So we've sensitized our government partners to that reality. They're aware that opening more spots in specialties, if we could get past the kind of political roadblock, would help to keep our trainees here in Quebec, to the extent that that's a good thing. I have more of an open view of that, but certainly the government thinks that's a good thing. And could attract people from outside of Quebec to come as residents to our top programs and then stay here to offer service. So we talk about these things. Definitely, and look for ways to advocate. It would not be easy for us to change proportions, but as the numbers of medical students are rising, the number of CARMS slots will rise. And so even though the proportions might not change, the absolute number of people coming into training programs, including in specialties like surgery, will go up in the next few years. So that's what we're working on. If some of you are involved in your specialty organizations or the FMSQ, I would like to know about you. feel free to send me an email. I think we should coordinate better across the faculty how we're using those political levers. So if you are involved in a leadership role or thinking about doing that, please let me know. I'd like to kind of assemble the various people in our faculty who are doing that kind of work and think a bit more strategically together to make sure we can keep the academic mission in any negotiations and also address some of the points you just raised, Patrick. I guess we are at 8:30, and I am sure you have other things to do. I appreciate you taking the time to listen and interact. And if you have other thoughts, I am more than happy to hear them. Lesley.fellows@mcgill.ca. Feel free to drop me a line. And I hope that if you're not already involved in some way in working groups or committees or whatever within your own department, or if you're interested in working at the faculty level, also drop me a line. I hope you'll find mentorship programs that work within your department. I know there's lots of cool stuff going on in that space already. There are faculty level programs. There's a Telemachus Scholars program that will be recruiting people again soon. If you're interested in that, let me know. I'll stop there. Thank you very much for your time this morning and for the work you're doing for the academic mission.
Thank you for your time with us.
Thank you. Thank you very much. And obviously lots of opportunities for engagement at the faculty level. So thanks for letting us know about the new plan.
All right. Have a great day.